practice and hone in on being a clinician, the best clinician that you possibly can, without the back end and the heartaches of everything else afterwards. Work-life balance is crucial. It's absolutely crucial for everybody. And we understand that. So that's just why we work hard, we play hard. Aspen Dental might not be for everybody, but at the time of day, you got to explore those opportunities, especially those that are D4. The time's going to come quick. Dr. Thompson, Dr. Abney can probably elaborate on their time and some of the things that they would recommend to do, maybe the things that they should have done, and maybe give you guys some guidance in that point of it. But we do have a couple of questions dropping into the chat. So how long were you in Aspen until you could be trained in implants? Do you need to be at a particular position to be trained? We got a blockage here. Trained in implants. And then part 2, do you get to choose what CE courses you'd like to do from the beginning of your tenure? So with that, Doc, which one of you guys would like to take question number 1 about how long it took you guys to get into the implants?
I think it's actually great for both of us because I think we are on very different timelines. So
that is fair. That's a good point.
Personally, I was very affected by COVID in my clinical experience. So my clinical experience was pretty much cut in half. I didn't work on a patient until summer going into my D4 year. So I wanted a lot of mentorship. I wanted handheld. I didn't pull a ton of teeth in dental school. I think I graduated pulling like 10 or 11 teeth. So I was uncomfortable with surgery. So I wanted to really get my surgical skills down, make sure that I was not going to struggle with the extraction when I was going to place the implant. So I actually took, up till this point, so I'm going in November. So about 2.5 years almost to go to my implant training. But I chose to slow that down. So I think that's something to kind of value too, is that Aspen is not pushing you to do these things. You can do them at your own pace. You don't have to go place implants on day 1 if that's not what you're comfortable clinically doing. But I think Dr. Thompson went a lot faster than I did. So let's hear from him.
That's a great point.
Okay, yes. So the way my journey was, I started as an MCD in Owatonna, Minnesota, and had great support from my territory manager, from my RM. And they put me in the best position. They said, "Hey, we're gonna move at your pace. We're gonna train you. Don't worry. We're gonna get you prepared to be able to run the clinic." And they absolutely did. Even first month out, we absolutely nailed it. I'm gonna say we were able to double production, which was something that was just astounding, and that just shows you the training they were able to give me from right out the gate, just to be able to build on what I learned in dental school. I'm gonna say I went to the implant course probably about 8 months later. Because they did a great job once again of showing me how to pull up the metrics, showing me the things I need to focus on to grow clinically. They did a great job of making me feel comfortable cutting crowns, extracting teeth. And then it kind of got to the point where I was like, "Hey, doc, you're doing full mouth EXTs an hour now. I think you're to the point where you've extracted enough teeth that you're really getting this down. How do you feel about expanding your skill set?" And me, I was ready to go for it. And once again, Aspen, they'll start you off with your initial journey, kind of get you go treatment planning. They'll go over the denture process with you again. At the 6-month journey, they'll kind of start talking to you about motto, clear aligners, which is something that's amazing. But once again, they'll go dig deeper into implants. And during that time, there's also some online CE you'll take that'll kind of give you that background, kind of touch on that knowledge we got in dental school to kind of re-emphasize that for you for those implants. So I was doing that during the time as well. That made me feel even more confident about going into it. So it kind of gets you excited to say, "Hey, I've done all this. I'm ready to go drop some implants on some live patients now." And so I went to the implant course, and I believe it's about 3 or 4 days. And during that time, you have someone next to you with you, walking you through every step of the process. I think I dropped about 10 to 20 implants over about 3 days, I believe it was. And it was an amazing experience. And I'm still growing and learning today. And I will say, I know we talk about the implant course a lot, but even in my area, when I first came back to drop my first implant, another doc came in with me who was very experienced, and he said, "I'm going to be here with you every step of the way. And if you have any questions, just let me know. I'm just here to guide you through." Before the surgery, we just walked through it together. During the surgery, he was in the room assisting me, and he was there after to see if I had any questions. So that's one thing I really do love about Aspen. Once again, is the support's there. You can kind of grow at the pace that you want to grow. If you want to move fast, you can move fast. If you want to slow it down, you can slow it down. But knowing that someone's here for you is something as dentists we don't really have. After dental school, I've had so many of my peers tell me, I missed that, I lost that. And I've had so many peers come over to Aspen now, and they're telling me, like, it feels good to be in a network again, to have support. So I'm kind of proud of the choice that I made, and it's still paying dividends now, not only for me, but for many of my peers.
Yeah, no, and I love to hear it. And of course, obviously, this is a great topic, and it's yielding a lot of additional questions. But I don't want to skip over the fact that, there's a lot of questions about the CE and the opportunities. And, as we're elaborating on the implant training and development and who we have and what we offer, CE, we have a whole web database that's available now to you guys as dental students. So, when we finish up this chat and everyone that's registered for the call, we'll send out a follow-up email. We can provide that link for you. You can have access to it as well. As far as the implant training, we changed the state legislature and state laws in Illinois that you can get a temp license to practice on live patients in Illinois. And that's what Dr. Thompson's talking about. That's where he did do this implant training. That just goes to show the level of interest and value to the clinicians that we have within Aspen Dental. We want you to succeed. We want you to grow. We want to provide all those access and resources for you to the best of the ability that we can. And Dr. Wall says it best, with that, you provide, you place, and you restore. And that's exactly what you're going to do as far as those training and those opportunities. And it's right there in Chicago at our headquarters. We have the Oral Care Center that's right there. Tag University is right there as an opportunity. And the Extraction Academy is all right there. And I can imagine most of the folks on the call, just like Dr. Abney and Dr. Thompson, like what they were looking for outside of dental school is a little bit of mentorship and assistance and continue their growth path. And and then of course that comes with confidence. And how do you get that? It's just repetition and trust, and to have that person, that mentor, and that guideline to assist you to get to that point. So yeah, we'll keep moving on with that. But one of the other questions is, what is the most important piece of advice you wish to give as a D4 student? Either one, you can take that one. I don't know if you got.
The best advice I can give a D4 student,
Yep.
I'll take it, because when I was in my D4 year, the biggest thing, I would say keep an open mind. So when I was in D4, I was looking at my deal going to Minnesota, and everyone who was in my class was like, he's crazy. He's going to Minnesota. He's leaving Texas. And the thing I can tell you now, many of my peers, a lot of them are moving around now. A lot of them are leaving. Many of us sacrifice in undergrad, leave out of state to go to undergrad. Many of us were willing to go to anywhere to go to dental school. But for some reason, whenever it's time to get a job, we kind of close our mind off, right? We kind of lose that piece of ourselves that allow us to be in such great positions. And I tell so many people, don't limit yourself. Even here in Minnesota, I've been able to bring out some of my peers who I went to school with who I never thought that they would move based on the conversations we had when we were in dental school. And now so many people are moving because they're starting to learn, wow, clinically, we start to separate ourselves from our peers after we leave school based on the opportunities that we just simply take that are presented to all of us, right? And part of that was joining Aspen Dental and putting myself in a position to be able to grow. And I just simply stayed in contact with a lot of people, and I shared that story. And I think they saw through my journey because they knew me. They were like, wow, this is absolutely amazing. And that's what brought a lot of them over to do it as well. So as a D4, I want to tell you, keep an open mind. Don't lose months, or even a year waiting to make the right decision, the thing that has gotten you in the position to be where you are now. Invest in yourself, invest in your growth. I never thought that I'd move out of Texas, but I got to tell you, I'm truly loving Minnesota, and this is kind of where I want to stay now. So you never know where life's going to bring you. You never know the joys that's out there for you. Sometimes you just got to go out there on a limb. And for me, it paid off very, very well, and I'm extremely happy with where I am. And that all came down with having that confidence in myself and kind of standing alone and being willing to move, and I did it. And now, once again, it's worked out for me and my peers as well who have followed in those footsteps.
Yeah, no, thanks, Doc. And that's fantastic. I'm going to kind of bounce around with the questions that are jumping in the chat. A lot of them are coming through, but everything you just kind of elaborated on, I think kind of matches up well with this question. And the question is, what does the application and interview process look like? So I can speak on that first and foremost, because as an academic manager working with the schools directly, myself and the town acquisition manager that assist, we partnered together and with a lot of the dental schools. And the reason we do that is to be the best available resource to you. And so when we do that, we have these conversations, we reach out. If you get an email or a phone call or a text message, or if you see something coming up that we're doing an event in town, by all means, register, jump on it, come answer the phone, or respond at a free time to chat, and we can explore those opportunities with you. So that would be the first introduction to Aspen Dental, how to get involved and how to, affiliate yourself a little bit to kind of see what you can do and what the process is and some of the locations that you're interested in. But as far as the interview process itself, what we'll do is we'll have that, trying to figure out what's best for you, what your goals are, what your motives are, where you're looking to go, and some of the compensation piece as well. And from there, that part of the talent acquisition manager's role is to support the doctors like Dr. Abney and Dr. Thompson. If they have an opening, that's why we're here. That's why we exist. And we try to find that right fit. So that's a brief snippet as to how you guys can get involved. And of course, the first step that I would recommend is reach out to your academic manager, go to an event if we're hosting something within the school. And from there, we can answer all those questions, or reach out to me directly. I'll share my point of contact after this call. We'll send everybody a follow-up email. We can answer those for you guys. But we'll move on to the next question, and that is there an average number of patients that you are required to see per day? Dr. Abney, you want to take that one because you kind of elaborate pretty well on your associate working out of the one chair and moving up to an MCD and now having four, and I think it's a great one.
So per Aspen, there's not a minimum number of patients or anything that you have to see per day. That'll kind of depend on your office's demand. I actually grew with my office, which was one of my favorite parts. I joined when we were only 6 months old, and now we're almost 3 years old. So when I first started, we were only seeing like 1 or 2 new patients a day. So we were a slower office. At that point, I was probably seeing 5 to 10 patients a day when I was an associate. Now we see 6 new patients a day as the practice has grown, and we've got great word of mouth in the town that we're in. And our average is anywhere from between 25 to 30 patients a day, which as a D4 sounds super overwhelming, but also you have to remember you have your EDAs, you have your DAs, you have your hygiene. The more you train your staff, the more patients you can see.
You just went back to another question that was there. What does the support look like inside of an Aspen practice?
Yeah, so how the roles kind of work in an Aspen as far as clinical aspect, you've got DAs, as many DAs obviously as your office needs. We've hired DAs as our office has grown. We started with 2 and now we're up to 5. I'm also in Colorado, so our DAs can do a lot more than a lot of states' dental assistants can do. So for example, I have an EDA, and she does basically anything that doesn't require a handpiece. So when I have fillings, I just go in and prep, and then I leave the room and I don't see that patient again. She fills, she adjusts bite. And then same thing with all my crown buildups. She does all my buildups. I come back, refine. So that helps me be super productive. And then you have, of course, your hygiene. So they're running the hygiene column for you. You do not have to do any hygiene with Aspen. That's always a very big question with D4s. And then as far as your front staff, you have your PEC. That's your front desk. That's who's greeting patients, doing confirmation calls, that sort of thing. And then you have your OL, which is your office lead. And they're kind of in charge of the little tasks around the office and supporting the office manager, who is the person who does all your new patient consults and obviously supports the staff. And then the other great thing that I love about Aspen is that every single office has a lab on site. So your lab tech is in back. I love being able to just communicate directly with my lab tech, not having to write it through a lab script or send photos. We can just go back and plan things together and really work collaboratively.
Yeah, and no, that brings up a great point, Doc. Can you elaborate on some of the technology you guys have within the practices? Because that'll paint a picture of what Aspen Dental as a whole has across the organizations.
Absolutely. So I would say Aspen Dental does pretty much everything to the highest standard. The only thing that Aspen doesn't have at this point is 3D mill crowns. But it's a big quality thing. 3D mill just doesn't work as well as lab crowns at this point, which is why Aspen isn't doing the 3D mill just yet, but I've heard it's in the future. But we have CBCT in every single office. We have scanners in every single office. Everything is digital. I haven't taken a PVS impression since I started with Aspen. Everything is what would you say, 50% of the labs are digital at this point? Do you know what that percentage is?
I don't.
I know it's a pretty large percentage. I know it grows every year. So
Yeah.
but a lot of the labs are fully digital. I'm an analog lab still, but I know 3 of the other offices in Colorado are digital at this point. So my office is supposed to go digital in the next year or so. So it's nice doing everything as high end as possible.
No, that is fantastic. Thank you for that. Dr. Thompson, maybe we could take this one. What made you pick Aspen Dental over other job opportunities?
Okay. So one thing that really made me choose it is once again something that's huge to me. I kind of elaborated on this is just work-life balance. I think that that's something that's really important when we come out of school. CE, continuing education, was something that was really important. Then, of course, we always want to make sure that we're always looking at finances, making sure we're in a good position, to kind of make investments that we want to make, but also live the lifestyle that we want to live. And those are the 3 pillars that I kind of stand on when I look at a deal. And Aspen offered me something for all 3 of those. It checked every single box. And ultimately, that's why I ended up choosing Aspen. And I think even when you break those categories down and you rank it to say, okay, if someone else did offer me all 3, was it even as good as deals Aspen? And I can say absolutely not. I can tell you, many of my peers know when I was in dental school, I'm going to say I did at least 15 interviews. I really started very, very early, right beginning of D4 year. And I'm going to say I signed a deal by December. because I had already talked to so many people, already put the work in, and I was able to compare the offers. And Aspen by far offered the best deal. And even now, just everything, I'm even hearing Dr. Abney, hearing myself, we're here for a reason, talking to you guys, because everything that they have told us, have promised us, has been fulfilled and beyond. If someone told me that the plans I had for myself at year 5 are already completed, majority of them, coming out even just a year out of school, I can't just be more grateful or more thankful. It truly has been an amazing experience.
Yeah, thank you for that. I'm going to tie this question back into that as well for you, Dr. Thompson. Were you guys both placed at your first choice of a location? And you guys can both answer that one honestly. Kind of elaborate on how you went from dental school where you were to where you are currently. Maybe what that process looked like.
Okay. So for me, the process kind of started is actually went to a conference when I was in dental school, and I actually met the territory director for Minnesota. Um, and I was very fortunate to meet him and talk to him. Name is Josh. I always give him the biggest shout out. Absolutely amazing guy. Someone who I would think any one of you guys would be very fortunate to work with. Every time I see him, just amazing. I would look at as like a mentor, just kind of guiding me, helping me through Aspen. But after talking to Josh, he kind of just told me about the opportunities in Minnesota. But he also told me like, hey, let me know what's important to you. And if I don't feel like Minnesota can offer it to you, if the opportunity isn't available there, we'll find another location for you. Because I just want to see you get exactly what you're looking for. And when you hear stuff like that, they kind of let you know, like, hey, I feel comfortable talking to this guy. He really cares about me. And even though he's over in Minnesota, he's making sure that he looks out for me as an individual. He's like, whatever you need, we're here for you. So kind of just continued that conversation with Josh. And also another recruiter, her name's Erica. Absolutely love Erica. And she kind of walked me through and said, hey, Doc, these are some opportunities we have throughout the US. We kind of want to make sure, based on what you told us, I think these are the greatest opportunities. But of course, after talking to those two, and talking to Josh being in Minnesota, I was like, I think who you work with and enjoying the person you work with and trusting the person you work with is so important. And I felt like early on we formed that bond, and it really made me excited. And that's what brought me to Minnesota. So that's what that process was like for me. Both of those guys, every step of the way, was there to answer every question for me. Then, of course, you have the academic team helping you get everything together, all your paperwork. Throughout the entire process, you're never alone. You're always, if anything, the team just gets bigger, the people supporting you and helping you. And I know that's something that worries many, many people. So I can keep going on, naming names, but as you can see, as the process goes on, more people come on and support you and help you. But I'm going to say in the beginning, I really want to give those people a shout out because they are the reason why I am here today. And I'm so thankful that my journey went that way, that I got to meet those guys.
Yeah, it's a fantastic story. Dr. Abney, you want to elaborate on yours?
Yeah, so I also worked with Erica. I love Erica. She's one of the
Yeah.
sweetest people in the world. And she set me up in Colorado. I did get my first choice of clinic, so I got lucky there. But basically she helped me find that arrangement. I told her my fiance at the time, husband now, works in Colorado. That's really my only option. And at first she was transparent. She was like, we don't have any openings in Colorado. It's probably not going to happen. And then she texted me in February and they were looking for a doctor at the last minute. So she actually kept me on the back of her mind, kept me kind of on her priority list. And as soon as she had open what I wanted, she was able to do that. And I think to Dr. Thompson's point, yes, it's great to have an open mind, but if you are someone that are kind of locked into a location, I like Aspen because they were very transparent with me. They were like, look, we would love to have you on the Aspen team. You're great, but we're not going to have openings in that area. So I like that they don't just try to like force you into wherever they could possibly fit you. They're very understanding too. Sometimes we have limitations and they work around with you too and try to do the best they can to get you on the team.
Yeah, no, and both of those are fantastic answers. And when you look at if you're as a dental student, say you're D4 at the moment and you're exploring some opportunities, it's most important to be open and honest and have that communication. Dr. Thompson was talking about Josh Letter. I've met him a few times, and he is absolutely a fantastic person, a great advocate for Aspen Dental, and he'll do what is right for you as joining the team. And that goes into your story and part of the location that you're looking to do. Maybe it's not within the state that you're looking to explore to have that opportunity right away. The best part about Aspen Dental is you will have that mentorship anywhere that you go. You're going to have that. And, we can do these internal transfers. It's not really where you start, it's where you finish. And we have that saying and that slogan. And, maybe you start out, you get the mentorship and you get all those opportunities that you're looking for and you get that experience. And then maybe a couple years from now, you want to take a lead position somewhere else, or you want to own a practice somewhere else. And, that's another conversation for another time and another virtual learning series is practice ownership. But yeah, the world is yours and the opportunity is yours. Like you said earlier, it's turnkey within Aspen Dental, and your opportunity is there for you the taking. It's your story, it's your path, and it's your journey, it's your timeline. And some of these questions that came through were, is there a quota, and what does this look like within the office staff? And there's not a quota. And the docs can talk about this with you guys, but we don't want a quota. We want to put you in numbers. We want you to be comfortable. We want you to give the best patient care that you possibly can. That is priority. That is always going to be the priority. And some of the stigma, it's not that. And docs are here to explain what there is, and if they've had that experience, or if they haven't, to share that and kind of elaborate on that for you guys. But just going across the board, and some of the other questions too is, do we have orthodontists and specialists within the practices? And we don't have the orthodontist piece, but we do have model, and the clinicians and the doctors are able to provide that to those patients in that care. So there's a wide range of opportunities in CE and growth, and whatever you're looking to expand upon, it's there for you. And if we don't have it, more than likely we can get you to a course somewhere, and you talk to your owner, your mentor, and we can get that there for you. But to elaborate on what is in the practices, Doc, do you want to kind of hit on maybe the hygienists and the oral surgeons and the endos that you guys have that rotate through and what that looks like?
So the only specialist, I'm not sure about you, Doc, but the only specialist that comes through my office is endo, because me and my owner do all of our own surgery. So we don't have an oral surgeon. But if you don't want to place implants or you don't want to do the super advanced surgeries, you do have an option to have an oral surgeon at your practice. I don't know, Dr. Thompson, do you have more experience with that?
Yes. So we had an oral surgeon and endodontist coming through our office. Right now, we're going to get a new endodontist coming through, but we definitely still have oral surgery coming through. So whenever we do have the more complicated procedures, like a lateral sinus lift or anything like that that needs to be done, wisdom teeth extractions, we'll give that to the oral surgeon. He'll kind of come through, or et cetera. Any of the various complicated surgeries. Oral surgeon will be there. He'll come through and take care for the patient. He kind of rotates around clinics throughout Minnesota. And I'll tell you, that's a huge benefit, not only for the patient because someone's coming to them, but also for us growing as docs, right? Because oral surgeon is someone great to lean on. Just when you just have just random questions that you may want to know, like how would you go about this, or what's a more efficient way of doing something, or just simply if you'd like, hey, is it okay if I shadow you one day? I kind of want to expand my knowledge here. Is someone great. We have Dr. Mahoney here in Minnesota who is a fantastic clinician, someone who helps out all of us and is always there whenever we need him.
Perfect. And with that, Doc, how would you guys say, one of the questions here is, how is your performance actually evaluated? Or do you have an evaluation throughout the prime? Maybe starting out within the first 6 months as a new doctor joining, what did that look like as far as left seat, right seat, hands-on mentorship?
So for me, with my owner, we were doing weekly reviews. So we would meet on every Friday after work and just kind of discuss our big thing. We always discuss the wins for the week and then where we could look to improve in the future. And then obviously, as I became more comfortable, we made it bi-weekly, and then we made it monthly. And now we check in every other month, kind of go through the metrics, go through clinical cases. Another thing that my owner does that actually quite a few owners in the company do is he actually does a month or a quarterly meeting with all of his doctors in all of his practices, and we all bring a clinically complex case and we talk through it. We talk about what the outcome was, maybe how things could have gone better, what we can learn from the case. And that's like 4 or 5 cases that you're getting from other doctors that were real life patients that just happened in the matter of the last couple months. And I think it's great. I think the moment in dentistry that you become stagnant and you stop learning, your clinical skills are going to drop. So I love the collaborative environment and talking through cases and just learning from each other.
Yeah, absolutely. Dr. Thompson, can you guys elaborate on what does your schedule look like? What's the hours a week? What does that look like and why?
So what my schedule kind of looks like, I'm working 8 to 5 Monday, Thursday, 8 to 1 on Friday, one Saturday per month. Generally, do you kind of want me to go more into what a daily schedule would be like?
Yeah, that'll work.
Okay. So kind of what a daily schedule will look like. Once again, you'll have a production column, and then you'll have your two new patient columns, and then you'll have your overflow. Overflow would generally be where you would do denture steps, where that kind of would be done. You kind of have a limited exam. You might want to put that one in overflow. Of course, production will kind of be your crowns, your fillings. That's where I'll put when I place implants or anything like that. And of course, a new patient column is where your new patients are going to come. And there'll be two columns that'll kind of run. And usually that's kind of the way my day goes. And no matter what's on my schedule, I just see it as conquering carries, right? That's kind of, you just keep it simple every step. And it almost kind of becomes repetitive in a way, because I just kind of view it that way, just conquering carries. I don't make it complex. And then the one thing I'll tell you is with the training that you have at this point, you have more than enough time to complete every task that's available to you. And you're trained well enough to where you're going to be walking out of that room super confident, because you're going to realize that when it comes to talking to patients, you're going to be trained. When it comes to treatment planning, you're going to be trained. When it comes to denture steps, you're going to be trained. So kind of it's like you become part of a well-oiled machine, and you become a well-oiled machine yourself. And it really does help you step up and become a leader in your office. So now when I kind of look at my day to day, I kind of have to think back sometimes. It's like, oh, what did I do today? Because now my day is more so, look how many people I was able to help, rather than focus on what I was doing. And that has been an amazing feeling.
Yeah, and part of that too, going into it is, there's a question here that says, hey, do you have an obligation to complete a procedure at a certain amount of time? And what does that look like? And I guess going back to the beginning, as your new doctor journey, I mean, you guys set up your scheduling, right? Like you put a lot of time that you wanted to, and maybe Dr. Abney, if you want to elaborate on that piece, and, maybe your time as you got faster and you kind of trickled that down, what did that look like? And who did you talk to?
Yeah, so I went to my owner through all that because I only ran the one production column when I started. Because again, we were focused on quality, 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 make sure I know what I'm doing. And then literally on my first day, because I was stressed out about timings, as most new D4s are, when you see that your crown prep is now an hour, not 3.5 hours. But I told my owner, I was like, look, I'm a little slower. My clinical experience isn't as high. And he literally was like, let me pull it. And he pulled it to a 3-hour appointment. And he was like, I don't care how long you take, just make sure it's right, and ask for my help if you need it. And he kept that mentality for the first 6 months. And I think just having the flexibility of someone's not breathing down your back, telling you need to do these 4 fillings in the next 15 minutes allows you to get better faster, because you're not so stressed out about the requirements, right? Because I had friends that were in other DSOs and were in private practice. A friend texted me one time that her doc, and this is with another company, came in and was like, you need to wrap up in the next 2 minutes. And she was like, I'm not even close to done. And she was like, figure it out. And it was like a
Oh,
very
wow.
negative experience for her, as you're trying to learn and make sure you know what you're doing, right? Like you don't need that added stress. So I had a very positive experience with Aspen. I never once was told I needed to speed up or get faster or move my times.
Yeah, thank you so much for sharing that. There's two questions here that are kind of like going together, and one's about a current D4 looking to explore some opportunities. And one of the questions is, how did you choose Aspen with a very similar offer? And the other part is there a contract? And I'll kind of elaborate a little bit in the docs. You guys can put your piece in there too afterwards in your experience as well. But first and foremost, Aspen doesn't have a contract. We do have a letter of an agreement. And another question here is, do you rotate between practices? And that is a possibility. You can, but that's all negotiable with the practice owner that you're working with. All the practices within Aspen Dental, or 87% of them, are individually owned by practice owners. So what that means is you're interviewing. So myself as an academic or the talent acquisition manager, depending on where you're looking to go and your needs and your motives and your career goals, we'll match you up with the right practice owner. But it's on you to have that question. It's on you to network and to interview the best that you possibly can and kind of negotiate that contract a little bit. Now, the doctors are going to know what they can compensate. They're going to know what they can provide and what they can offer to you, but we don't have an actual contract for you. What that looks like, it's going to say like, hey, here's the practice that you're going to work with. This is going to be your daily rate. This is your bonus opportunity. And what's the bonus opportunity? What does that look like? Compensation piece. And that's the profit sharing model. So that's going to be, you have the production of the general dentist, the oral surgeons, the hygienist, the patient satisfactory survey, and all that gets factored into one. You get that payout at the end of the month. So that just automatically creates this team environment. So there's no pressure, there's no quota, there's no fine line behind the print of, hey, if you don't meet these quota within the first 6 months, you have to start paying the money back. We just don't do that. We don't want that experience. That's why we don't have the letters, or we don't have the contracts. We do have the letters of agreements. We don't have the restrictive covenants. There's no non-competes. That just creates a tension and hectic work environment that's just not the right thing, because at the end of the day, what that is going to affect is the patient in your chairs. And that's exactly what we don't want. So with that, docs, do you guys have anything as how you were able to decipher between Aspen over another similar offer, if you had a similar offer?
I can kind of touch on that a little. So I did have a similar offer in Texas. Compensation was pretty close. He was offering to train me on implants. And this is something I kind of looked at. He was like, "Hey, I'm just kind of looking for a second doc. I'm gonna open up a second office." And to be honest, the thing I thought to myself was, "Where you're telling me you're gonna train me on implants, but you're also telling me I'm gonna be alone in the second office, and I'm relying on you to train me to do these things. So how are you actually gonna train me to do the things that you're telling me to do?" And I could have stayed in Texas, closer to family, but it just didn't sound. It sounded too good to be true in a way, because it's like as I dug deeper into it, I'm like, okay, this kind of seems like where I'm going to end up doing most of the fillings, a bunch of crown preps. Where's my growth going to be? I was like, I will be closer to family, which will be great. However, what type of dentist am I going to be in 5 years? What am I going to be able to do? Am I going to be in a position that my mentors are in? Am I going to have that skill set? I want to see myself in the best possible position as a clinician. Um, and that's why I kind of chose to decline that offer and go with Aspen, because when I went with Aspen, it really is a well-oiled machine. Once again, they were like, "This is what you're going to do initially for your training. This is what it looks like. This is what you're going to do at 6 months. After this time frame, if you've completed this, or if you have any questions, and if you're ready, we'll be able to get you to the implant training." So it was very thought out, very well organized. They were able to say, "Okay, no worries. We'll make sure that someone covers your clinic. We'll be able to get you out to Chicago, and we're going to make sure you get the training that you need." So kind of also having that conversation with Aspen, seeing how they were telling me how I was going to be trained, what it looks like, and the answers they gave versus the other answers I got from the other offer. And I took it as my number two offer. It was just very different. And once you get somebody kind of talking to you genuine, and you see somebody who has a game plan laid out for you for your career to help you get there, it becomes easier to understand when someone really doesn't have a game plan, when things can become ambiguous. And from a lot of experiences, not for myself or for my peers, when I hear that they did take offers like that, they never got the training that they were promised. And I can only speak on the once again my peers. This isn't to say anyone else doesn't, but they were like, "Hey, John, it's amazing you're placing implants. I think I would like to come over to Aspen because it's just not working out the way that we had anticipated." And that's why a lot of them came over to Aspen as well.
Just to kind of piggyback on that as well, I am in a group chat with 10 of my friends from dental school, and only two of us are still at our original job. It's
Oh
only been
wow.
2.5 years. So, me being one of them, obviously, but I would say dig deeper, ask more questions, really get the fine details on this great elaborate plan. Kind of what Dr. Thompson said. If it sounds too good to be true, it probably is. Ask more questions. I think the really great thing about Aspen is everything that they offer their doctors, they back up. So if that's the mentorship or the structure or the pay schedule, I've never had them tell me something and it not be true. So, and I think a lot of my friends ran into the opposite situation.
Yeah, and it brings up another great point, and for me personally, and why I chose Aspen Dental as a non-clinician is the culture, and it's the culture is the same as a clinician to the support staff and everything behind the scenes. And I'll give my team a shout out when I met them. Again, I was reaching out before I transitioned from the service, and part of that was to meet part of the Aspen Dental academic team. And when I met them in person, it was like there was a feeling of like this feels right, and the team 3.5 years later is the exact same team. So shout out to Maggie, Crystal, Jeff, and Murph, and all the guys, and everybody else on the team that supports everybody across the board. But I'm Dr. Abney, Dr. Thompson. I'm sure you guys have the same thing. And Dr. Thompson spoke heavily about Josh, and those are the conversations, and those are the types of things that we can introduce you to as far as the networking opportunities to keep you in an open opportunity. Explore the mindset of what are you looking to do, where are you looking to go, and maybe you're looking to go to one place, and based off of your goals and your what you're looking to get after dental school, it might be in another state, a sistering state, and just exploring those opportunities is best. But the next question, how long is the training in Chicago? I'm not sure if they're asking about the implant training or if they're asking about the new doctor training, but maybe you guys can elaborate on a little bit of both. Dr. Thompson, for you, especially with the implants.
Okay. So I'll kind of start is it okay if I start the new doctor journey?
Yeah,
I'll kind of walk through.
absolutely. Yeah, definitely.
So with the new doctor journey, I'm gonna just say you'll start off and you'll do training. Like there'll be a doc if training you in your area, and you'll go to another clinic, you'll train, and they'll kind of get you started through the processes. They'll get you onboarded, and they'll start say like, this is the way you can become efficient at extractions. One thing I became great at doing is like atraumatic extractions. That's one example I'll give you. When you start with Aspen, coming out of dental school, We kind of learn a way to do it, and then you learn that there is a much more efficient and easier way to get those teeth out. And Aspen absolutely does that for you. And then upon that, you kind of finish that training for a few weeks, and then you'll go to Chicago. And then up in Chicago, you'll be there for about a week. And during that time, you'll kind of sit in a classroom for part of it, but they also have like different things you'll do where you'll go into operatory and you'll go over treatment planning. They'll go through denture steps with you. And you'll do that for a week in Chicago. But not only that, you'll get a chance to network. You'll get to meet more of the team. They'll really bring you in house. It really is a family feel. It's such a large company, but I feel like we all really just get to know each other. You kind of just start seeing the same faces over again. Um, and then even after you finish the day, there's always social events for you to continue networking. But during the first week, that's kind of what you're going to go through. And then once again, you'll go back 6 months later to kind of take it to that next level. We're going to kind of go through those treatment planning steps again. We're going to try to talk about motto clear aligners again to kind of see what are more ways we can help the patient. You're going to dig deeper into, okay, this is where we're going to offer in implants. And not only that, they actually brought in Zest. They actually brought in Straumann. So they say, hey, this is what it's going to look like whenever you're going to place a locator. You're doing all this. They said, hey, if you're going to do motto, this is what it's like to put attachments for clear aligners. And you're doing it right there in the classroom. You have the company reps there willing to help you out. So this training is legit. Like, this isn't just you seeing it, but they're also doing tell, show, do right there in the classroom. So you build that confidence right there in Chicago where you're ready to go back. And then on top of that, I mean, even for me, that's why I was so excited to get the implants. I was like, this stuff is, so fresh in my mind, and I really want to build on it right away. So I immediately got back and I was like, hey, let's keep going for this implant course. So I went back, I signed up for the implant course, went right back out to Chicago. And then you kind of start out once again. They start you off in lecture. They kind of say they start from the very basics. They say this is what a kit looks like. This is what should be here. This is what each instrument inside this kit is for. They'll go through the naming for every single instrument. They'll even go to the medical history of the patient with you, and they'll say this is what we'll be doing today. They'll show you guided and non-guided placement of Straumann implants. They'll kind of introduce you to the reps. They'll say if you need to return an implant. So I mean, they go over every possible thing that you can think of, and they say if you have any questions or you forget anything, here's an Aspen reps number for you to call one of the docs. But here's also Straumann support that's going to be specifically for your region. And they say this is your Straumann rep, and they'll contact you, and you'll get an email so you know who they are. And then once again, by the end of the day, you'll kind of go in there and they'll say, okay, we'll start dropping an implant, and they'll start you off kind of simple. You may do an immediate extract and deliver. You'll do a guided surgery. You'll get some freehand in there as well. So the training that they give you, you'll feel kind of very confident dropping an implant in any scenario. Not only that, you get to do Straumann implants. As you're going to learn, it truly is the best implant on the market. So if someone's going to teach you something, always best to give you the best possible product. And you're going to see that's what makes me so happy when it comes to Aspen, is that they're using the best CVCTs and the best products for you to get the best possible success with implants.
Yeah, thank you so much for that, Doc. That was a great answer. Just to let everybody know, we got like 7 minutes left. So if there's something on your top of mind that you guys want to throw in the chat, the last few minutes of the questions, throw them in there. One of the other questions, I want to go back to it before we skip it. Are the lab fees covered, Docs?
Yes.
Yes,
Perfect.
absolutely.
Simple enough. Simple enough. Do patients also rate us after every encounter? Goes
So
back in the patient satisfactory survey.
one thing that we're really big in Aspen is our patient satisfaction score. So that ties into the bonus for the doctor. The higher your patient satisfaction score is, the higher the % of your bonus. But I think we all take that as a very prideful thing. I think as a community as a whole, we really, really want our patients to be happy. It's not a chop shop. That's not what we're going for. So we really want our patients to be happy. We really want them to feel like we've done something for them. So yes, the patients do get emailed a survey after their appointment, and they can give you feedback there.
Yeah, thank you so much. The next one, how soon can you move to an ownership opportunity? Docs, you guys have that answer?
Oh yeah.
Depends on a lot of factors, and I think it depends on your region and your owner too. I know my owner specifically said we could open up the conversation within 2 years. So my requirement was to be MCD and be implant trained. So almost check.
There you go. 18 months is about the average. So.
And kind of for my opportunity, I started out as an MCD. in an office that isn't owned, kind of help build it up. And right now, I'm already starting the conversation for ownership opportunity. Once you build an office up, it kind of becomes your baby. And when you kind of see that baby grow, um, you kind of just want to make sure you do everything you can and you're attached to it. So right now, I'm actually in the conversation about becoming an owner of the practice that I am, because I am proud of the work that we did there, and I am proud of where we were able to take the practice and the bonds that I form with the patients I have there. And honestly, it feels so good when a patient walks in, even today, it was another John, and he was like, "Good to see you, John." And it's so good when he was like, he literally told me today, real story. He said, "I just feel so comfortable with you taking care of me," and he was like, "I want you to know that." He was just like, "I can tell you absolutely care," and he was like, "I tell all my friends about you, and I send all of them here." And when you form that bond, and it's not just with John, it's with so many other people, it just made me want to be there, and I'm excited to be able to say, now I'm in the conversation to be owner of the practice. And I never thought that ownership would come this soon out of school, but I'm happy that it did come in the place I am.
Yeah, that's amazing, truly amazing. Some of the other questions in here, I'll answer those for you. But international students, we do a lot of these virtual learning series every month, and we change the topics. Some are new doctor journeys, some are the pathway to ownership, some are for international students, and what does that look like? And we really like to take some of the feedback from the students. So if you guys want to hear a topic and there's something you guys want to learn more about, by all means, let us know. Let your academic manager know. Shoot me an email after this, and we can kind of talk through that. If there's something that we weren't able to elaborate on to answer your questions for you, again, we'll send a follow-up email after all of this, and we'll have our points of contacts for you. And again, if you know your academic manager, absolutely reach out. If you don't, reach out to me, and I'll put you in contact with that person, that representative in your area, and we can kind of go from there. But truly, the same thing for tonight. Everything that we're doing it's for you guys. It's for the clinicians that aren't even with Aspen Dental. You guys as dental students, D1s through D4s, and there's this call is to inform you to make the best decision for your careers after dental school. There were some questions about going into like AGDs or GPRs or specialty, and all of those things are fantastic, but you have to figure out what you truly want and figure out what your motives are, figure out where you want to go. And part of our job, part of my job more specifically, is to assist and guide you to answer all those questions so you can make the best decision you possibly can. So yeah, with that, we'll wrap it up a couple of minutes early. Again, if we didn't answer your question, guys, throw it to us in the email. We'll reach back out to you guys. We'll send the recording to all of you. We'll do the raffles here probably by tomorrow. So if you're one of the lucky winners, one of the 10 or 11, we'll either expect an email or a text message. But thank you for everybody that joined the call. Thank you so much for Dr. Thompson and Dr. Abney. You guys are absolutely fantastic. And I hope to see you guys at an event soon. And we'll kick it off from there. Thank you guys so much and have a great night.
Thanks,
Bye,
Brett.
y'all. Yeah,
All right,
thank you
thanks,
guys.
Brett. You guys have a great night.
Yeah, take care. Thanks, everybody.